Hi friends, now let us learn about the posterior compartment of arm. In the previous lecture you must have seen the anterior compartment of arm. Now I am just going to teach you the posterior compartment of arm. So now what are present on the posterior compartment of arm? As I said, the posterior compartment of arm is also the arm is divided into two compartments by medial intermuscular septum and lateral intermuscular septum. So the posterior compartment of arm has any other compartment. We are going to learn it in three main divisions, as I said: muscles, nerves and arteries. This posterior compartment of arm is the most easiest part among the all compartments because it contains only one muscle, that is triceps brachii, and it has only one nerve, that is radial nerve, and the artery is very well profunda brachii artery, which is a branch of radial artery. Okay, all these are the other components that you are going to learn in posterior compartment of arm. So now let's see the muscle. First, triceps brachii. The muscle triceps brachii you're going to learn now. So in the muscle triceps brachii, you have to learn about the origin first. This has three heads. One is long head, and the other is medial head, and the other one is lateral head. The thing is, in the cadaver, you can see the long, after reflecting the skin, superficial fascia, then you can see the long head and the lateral head. This medial head is seen when you retract this long head and lateral head, then this medial head is seen. So let's see what are the origins. For long head takes its origin, long head of triceps takes its origin from the infraglenoid tubercle, which is present on scapula. This is scapula bone. On the scapula there is infraglenoid tubercle. This is humerus, this is ulna, this is radius. So this is posterior aspect. This is not anterior aspect. If spine is present, then that's definitely the posterior aspect. Okay, and the second origin, that is lateral head. Origin of lateral head occurs from, before knowing that, you should know that there is a line here, that is radial groove will be there, or spiral groove. Okay, this radial groove, above the radial groove, there is the origin of lateral head. And just below the radial groove, on the posterior surface of humerus, there is the origin of medial head. Okay, why this is called lateral, why this is called medial? You can see this is a little medial than compared to this one. So this is called as medial head. If you see the radial groove, this radial groove is like this. So in comparison to the radial groove, this medial head is medial to the radial groove, and this lateral head is lateral to the radial groove. That is the reason why this is called as medial head and this is called as lateral head. And all this is inserted, all these are inserted into the superior surface of olecranon fossa. This is olecranon fossa, as you see, olecranon process. This is inserted to superior surface of olecranon process of ulna. So now if you draw the muscle, how does it look? Like this, and from the lateral head they are like this, and from the medial head they are like this, and all this comes and join like this. So this is which muscle? Triceps. And what's the nerve supply is radial nerve. As I said, it's radial nerve. And what's the action of triceps? This triceps, whenever it contracts, you can see that this moves like this. So if it is back, the triceps will be present on the posterior compartment. So what happens is, in the posterior compartment, if this is there, if this is in the pronated position, first if it is in semi-flexed position, and whenever the biceps contracts, then there will be extension. So it helps in extension of elbow. So what does this triceps do is, it helps in extension of elbow. It does nothing but extension of elbow. You can see easily, because if this is like this, so if it contracts, it makes these bones to come like this. So it's nothing but extension. So it helps in extension of elbow. The thing is, whenever there is full flexed extension, it doesn't help in further extension of elbow. But if it is in flexed position, in order to bring from flexed position to extension position, then this triceps brachii is used. Okay. The next nerve that is used is radial nerve. So what is the things that you will be going to learn here in the radial nerve? Let me first show you the relations and everything that you will be learning for radial nerve. Just a minute. Yeah. Now let me show you. First thing is, take this as scapula and this is humerus. This is the shaft of humerus, and if you go down, and what is this? Medial epicondyle, trochlea, capitulum, cochlea, and then lateral epicondyle. Okay. Now how will the radial nerve go? And this is the posterior aspect mainly. You can see this is the posterior aspect because of the presence of olecranon fossa. Okay. Now, the first thing is radial nerve. It comes like this. Radial nerve, it arises from the posterior cord of brachial plexus. It is the continuation of radial nerve. Now you are going to learn about what? Radial nerve. It arises from posterior cord of brachial plexus. First, in the arm, it lies posterior to brachial artery. If this is the brachial artery, see, if we draw the cross section, if this is the brachial artery, it is anterior to it, is posterior. Then it lies posterior to the brachial artery. Okay, this lies posterior to the brachial artery. So it will be somewhere here, and then it winds around the arm and it enters the spiral groove. Here I said there will be a spiral groove or radial groove. It enters the radial or spiral groove of humerus. That too between. Here I said there will be. Where are they? Where is that color? Yeah. Above the spiral groove there is the origin of medial head of triceps, and below the spiral groove there is origin of lateral head of above the radial groove there is origin of lateral head of triceps, and below the radial groove there is the origin of medial head of triceps. So this radial nerve runs between the lateral head and the medial head, and then it descends downwards. And here at this point the brachial artery gives its branch, that is profunda brachii artery. So it accompanies with profunda brachii artery. And then it pierces. Here there will be lateral intermuscular septum. As I said, septums are always in green. So here there will be lateral intermuscular septum. This radial nerve will pierce the lateral intermuscular septum and then will enter into the anterior compartment. This is anterior. If I draw in here, then this shows that it is behind this intermuscular septum. So as a result, it has entered the anterior compartment. And in the anterior compartment, it runs downwards and then enters the cubital fossa, and then it divides into two branches. That is superficial branch and the deep branch. So superficial radial nerve and deep radial nerve. Deep radial nerve is nothing but, to say clearly, it is posterior interosseous nerve, which is the deep radial nerve. So this comes the course of the radial nerve. So let me repeat it. Radial nerve is the continuation of posterior cord of brachial plexus. It then enters the arm by winding around the back of the arm, and it enters the radial groove or spiral groove. In the spiral groove, it runs between the lateral head of triceps and the medial head of triceps. And then it reaches the lateral part, and in the lateral part it pierces the lateral intermuscular septum, and then it runs downwards in the anterior compartment, and then it enters the cubital fossa. In the cubital fossa, it runs between brachialis and brachioradialis muscles, and then it comes downwards and it divides into two branches. So superficial radial nerve and deep radial nerve. Deep radial nerve now pierces into the enters into the posterior compartment and then continues as posterior interosseous nerve. And superficial radial nerve will supply to the branches, cutaneous supply. So now this is the radial nerve course. Now let us see the branches of radial nerve. So branches of radial nerve, in the axilla itself, it gives a branch. See, I said from the infraglenoid tubercle there is the origin of long head of triceps. So in the axilla it gives a branch to long head of triceps. And also it gives a branch to the that is cutaneous branch, that is posterior cutaneous nerve of arm. Okay, and then now it enters the spiral groove. In the spiral groove it gives a branch to the lateral head of triceps and it gives other branch to the medial head of triceps, and then it gives two more branches in the radial groove itself. One is the posterior cutaneous nerve of arm, forearm, because arm is given in the axilla, and the other is the lower lateral cutaneous nerve of arm. Okay, now in the anterior compartment it gives branches to brachialis, brachioradialis and extensor carpi radialis longus, which you will be learning in extensor compartment, and then it gives some articular branches to elbow joint, and it then divides into two terminal branches, that is superficial radial nerve and the deep radial nerve. All this is the course and branches of radial nerve, which is very easy in the posterior compartment. Now the next one that you have to learn is the artery. Which artery is it in the posterior compartment? As you know, the artery here is profunda brachii artery. As I said, profunda brachii artery accompanies here. So now let's learn about profunda brachii artery. So let me take the other page so that it will be a little easier. Yeah. So now we are going to learn about profunda brachii artery. What is profunda brachii artery? It is a branch of brachial artery. So let us see. This is teres major. So this is axillary artery. It continues as brachial artery at the lower border of teres major. And now this brachial artery gives a branch. This branch runs downwards like this, and this is profunda brachii artery. This profunda brachii artery runs along with the radial artery in the radial groove, as I said, and then it divides into two branches: anterior descending branch and posterior descending branch. Anterior descending branch and the posterior descending branch. These two branches are given by the radial profunda brachii artery. It is anterior descending branch and posterior descending branch. Let me say, this is anterior descending branch. This is posterior descending branch. Okay. Anterior descending branch is also called as radial collateral artery. Posterior descending branch is also called as middle collateral artery. Okay, this anterior descending branch, it anasmoses with radial recurrent artery, and this posterior descending branch anasmoses with interosseous recurrent artery. All these are the branches which you will be dealing in your next lecture. So this is the profunda brachii artery. This profunda brachii artery gives you some branches. One is the deltoid branch, so that it supplies to deltoid muscle. This is deltoid branch, and then it gives nutrient branch to humerus, deltoid, and then nutrient branch, and then, as I said, anterior descending branch and posterior descending branch. Anterior descending branch anasmoses with the radial recurrent artery, which comes from the forearm, whereas the posterior descending branch or middle collateral artery anastomosis with interosseous recurrent artery. So now, where does this anastomosis takes place? It anastomosis around the lateral epicondyle of humerus. Now you'll be learning about the anastomosis around elbow joint, then you'll understand this. This is lateral epicondyle of humerus. So this is anterior and this is posterior. Okay, now let us learn. Now in this lecture, I hope you have completed two main things. As I said, the main important things that you will be learning here in the posterior compartment is muscles of triceps and radial nerve and profunda brachii artery. All these you will be learning in posterior compartment. All these have been completed now. Now the next thing that you are going to learn in this compartment is the anastomosis around the elbow joint. So what are you going to learn now? Now you are going to learn anastomosis around elbow joint. In the elbow joint, as you know, for the humerus there are two epicondyles, medial epicondyle and this is lateral epicondyle. What is it? This is medial epicondyle and this is lateral epicondyle. So let me see. This is the profunda brachial artery, which is divided into radial artery and ulnar artery. Ulnar to the medial side and radial to the lateral side. This is ulnar and this is radial. And now this gives a branch. The brachial artery gives a branch which is the largest branch which you have just studied now, that is profunda brachii artery. This profunda brachii artery, as I said, it is divided into two parts, anterior descending and posterior descending. Okay, this is anterior descending. This is posterior descending. And this radial artery gives a branch called as radial recurrent. Okay, this is radial recurrent. And then this is ulnar artery. From the ulnar artery there is a branch that is common interosseous artery. This common interosseous artery gives a branch. This common interosseous artery again divided into the anterior interosseous and the posterior interosseous and interosseous recurrent artery. This interosseous recurrent artery anastomosis with posterior descending artery behind the lateral epicondyle of humerus. Okay, this is what happening. And then in the medial, what is happening is this brachial artery gives two branches. One is superior ulnar collateral and the other is inferior ulnar collateral. This is superior ulnar collateral. This is inferior ulnar collateral. Okay, and the ulnar artery gives two branches, anterior ulnar recurrent and posterior ulnar recurrent. This is anterior ulnar recurrent. This is posterior ulnar recurrent. All this anterior ulnar recurrent anastomosis with interosseous ulnar recurrent. Posterior ulnar recurrent anastomosis with superior ulnar collateral. Okay, all these are the anastomosis. Now let us simplify it. First, in front of lateral epicondyle. This is lateral epicondyle, this is in front. So in front of lateral epicondyle there will be anterior descending branch of profunda brachii anastomosis with radial recurrent artery. Okay, next, behind lateral epicondyle, posterior descending branch of profunda brachii anastomosis with interosseous recurrent. I is interosseous recurrent. Okay, interosseous recurrent, which is a branch of common interosseous artery. And next, in front of medial epicondyle, that is this one, there will be inferior ulnar collateral from the brachial artery anastomosis with anterior ulnar recurrent from the ulnar artery. And behind the medial epicondyle, that is superior ulnar collateral of the brachial artery anastomosis with posterior ulnar recurrent of the ulnar artery. So these are the anastomosis around the elbow joint. So the next thing that you are going to learn here is the total nerves of the arm. As I said, you have completed the radial nerve, which you have seen, and you have already completed that nerve, which is musculocutaneous nerve in the arm. And in the arm, there are other nerves of arm. Other nerves of arm. There are two other nerves which you will be seeing in the arm. That is, one is median nerve, and the second one is ulnar nerve. Because as you have already seen radial nerve in the posterior compartment, I am not going to discuss it. And similarly, you have seen the musculocutaneous nerve in the anterior compartment, so I am not going to discuss these both. But now, let us learn about the median nerve. So let me draw a picture of mainly the humerus so that you will be having an idea what is happening to it. Maybe the diagram is worse, but never mind. This is radius, this is ulna, this is radius, this is ulna. Okay, now median nerve. Median nerve, it arises from medial and lateral cords. There will be medial and lateral roots of median nerve. Median root of median nerve is from medial cord of brachial plexus. Similarly, lateral root of median nerve is from lateral cord of brachial plexus. So then, it runs downwards, and at first, it lies lateral to the brachial artery. See, first I am just drawing the one minute, a little problem in this, First let me draw the pronator, the teres major for reference. This is teres major. So now below the teres major there will be brachial artery. So this is the brachial artery which comes down and divides into two. Okay, and now, so this is lateral, I forgot to say this, and this is medial, it's just a small mistake. Okay, now from the medial, the median nerve arises from two roots, and then it runs lateral to the brachial artery, then it runs downwards, and in the middle of the shaft of humerus, it crosses the brachial artery from medial to lateral side, and then it enters the cubital fossa, and it is the medial most content in the cubital fossa. As you can see, you have seen MBBS, which is M is median nerve, which is the medial most content in the cubital fossa. And then in the upper part, this medial nerve lies lateral to the artery. In the middle part, median nerve lies anterior to the artery, whereas in the lower part, median nerve lies medial to the artery. What are the branches given by the median nerve? Mostly, it don't give much branches to the muscles, but it gives a branch to pronator teres in the cubital fossa, and it also gives an articular branch to the elbow joint. Okay, two branches. One is to the cubital fossa and one is to the elbow joint, and also a branch to the brachial artery, because arteries also need nerve supply. Okay, this is median nerve, and the second nerve that you have to see is the ulnar nerve. Ulnar nerve, it arises from the medial cord of brachial plexus. It is the continuation of medial cord of brachial plexus, and then it runs downwards medial to the brachial artery. It runs medial to the brachial artery, and then up to the insertion of coracobrachialis, and then at the coracobrachialis, insertion of coracobrachialis, it pierces the medial intermuscular septum along with superior ulnar collateral artery, and then it enters the posterior compartment, and it runs downwards in the posterior compartment, and it lies behind the medial epicondyle of humerus, and then it goes to the forearm. Okay, of course, it lies behind the medial epicondyle of humerus. So as a result, whenever you get an injury to the medial epicondyle of humerus, the main thing that happens is a stinging feeling. This stinging feeling is due to the ulnar nerve. So this is the two nerves which don't give any branches or least branches in the arm, but they run along the arm. So now this ends the total arm along with posterior compartment, anastomosis around the elbow joint, and also the nerves, other nerves which are passing through the arm. Okay, then bye.